In Japan, there's a 105-year-old doctor still practicing medicine who's seen thousands of stroke cases, and he says most people ignore the 3 warning signs that could save their life. What if you're missing them right now? Welcome to Prime Health Lab. Today we're talking about something that affects over 15 million people worldwide every year: stroke. But here's what most people don't realize. Your body actually warns you days, sometimes weeks before it happens. And if you know what to look for, you can prevent it. If this kind of life-saving health information matters to you, go ahead and subscribe so you don't miss what could be the most important video you watch this year. So let's start with understanding what's actually happening inside your body when these warning signs appear. Your brain is incredibly demanding. Even though it's only about 2% of your body weight, it uses 20% of your oxygen and blood supply. Now imagine your brain's blood vessels like a highway system. When everything's working properly, oxygen-rich blood flows smoothly to every part of your brain. But when something starts to go wrong, when a vessel gets blocked or starts to narrow, your brain doesn't get the fuel it needs. And that's when your body starts sending out distress signals. Here's the fascinating part. Dr. Shigeaki Hinohara, Japan's oldest practicing physician who lived to 105 and treated patients until he was 103, spent decades studying these signals. And what he discovered was that the body doesn't just suddenly have a stroke. It whispers before it shouts. The first warning sign, he emphasized, is something called transient facial asymmetry. Now that sounds complicated, but it's actually simple. This is when one side of your face temporarily droops or feels numb. And here's why this happens. There's a part of your brain called the motor cortex that controls facial movement. When blood flow to this area gets restricted, even for just a few minutes, the muscles on one side of your face lose their command center. You might notice it when you smile in the mirror and one side doesn't quite lift the same way. Or you might feel a strange numbness, like you've been to the dentist, but you haven't. This is what doctors call a transient ischemic attack, or a mini-stroke. The word transient means temporary. The blood flow gets restricted, but then it opens back up. The symptoms disappear. And this is where the danger lies, because most people think, oh, it went away, I'm fine. But Dr. Hinohara discovered through his decades of practice that about 1 in 3 people who ignore these mini-strokes will have a full stroke within a year. Your brain is literally practicing for the main event. Now, the biology behind this is crucial to understand. When blood flow gets cut off to brain cells, they don't die immediately. They go into what scientists call the ischemic penumbra, a kind of suspended state where they're starving for oxygen but still alive. If blood flow returns quickly, they recover. But if it happens repeatedly, these cells become weaker, more vulnerable. It's like bending a wire back and forth. The first time it bounces back, but keep doing it, and eventually it snaps. What makes facial drooping so significant is its location. The facial nerve pathway is one of the most sensitive indicators of stroke because it's supplied by a major artery called the middle cerebral artery. This artery is like a main highway that branches off to critical areas of your brain. When you see facial symptoms, you're seeing evidence that this major pathway is compromised. And here's something Dr. Hinohara emphasized that most Western doctors overlooked for years. These symptoms often happen during periods of physical or emotional stress. Why? Because stress causes your blood pressure to spike, which can dislodge small clots or cause existing blockages to temporarily worsen. Your body is showing you its weak points under pressure. The reason this matters is that stroke is the second leading cause of death globally and the leading cause of disability. But unlike a heart attack, where you feel pain and know something's wrong, stroke symptoms can be subtle. They can come and go. And because they're often painless, people rationalize them away. Now let's talk about the second warning sign, And this one is particularly dangerous because people almost never connect it to stroke risk. Dr. Hinohara called it the invisible stumble. Sudden episodes of unexplained weakness or clumsiness in your arms or legs, usually affecting just one side of your body. You might be reaching for your coffee cup, and suddenly your hand won't cooperate. Or you're walking and one leg feels heavy, like it's dragging slightly. Most people blame it on tiredness, poor sleep, or just getting older. But here's what's really happening. Your brain has a specific region called the motor strip that runs like a band across the top of your head from ear to ear. This strip controls all voluntary movement in your body. The left side of this strip controls the right side of your body, and the right side controls your left side. When blood flow to any part of this motor strip gets compromised, the corresponding part of your body loses its connection to command central. Think of it like this. Your brain is constantly sending electrical signals down your spinal cord and out to your muscles, telling them exactly how to move. These signals travel at about 268 miles per hour. But when a blood vessel supplying the motor strip gets blocked or narrowed, even temporarily, those signals get disrupted. It's like a brownout in your electrical system. The lights flicker, but they don't go completely out. What makes this so insidious is the pattern. These episodes typically last anywhere from a few minutes to a few hours. Your arm feels weak, then it recovers. Your leg drags, then it's fine again. And because it resolves on its own, your brain does what brains do. It finds a convenient explanation that doesn't require action. I must have slept on it wrong. I've been working too hard. I need more water. But here's the critical science. Every time this happens, you're experiencing what neurologists call a watershed event. Your brain has areas where two different blood supplies meet, kind of like where two rivers converge. These watershed zones are the most vulnerable to drops in blood pressure or blood flow because they're at the end of the supply line. When your heart can't pump enough blood, or when a vessel gets partially blocked, these areas suffer first. Dr. Hinohara observed thousands of patients over his 75-year career, and he noticed something Western medicine was slow to recognize. These motor symptoms often occurred in specific patterns. If the weakness affected your dominant hand, the one you write with, it was almost always a sign that the opposite side of your brain was being affected, specifically in the middle cerebral artery territory. This is the same artery we talked about with facial drooping. And here's where it gets even more interesting from a biological standpoint. Your brain has something called collateral circulation, backup routes for blood flow. When one pathway gets blocked, smaller vessels can sometimes compensate by expanding and rerouting blood. This is why symptoms can be temporary. Your brain is literally finding workarounds. But these backup systems aren't meant to be permanent solutions. They're emergency measures. And each time they have to activate, they become less effective. The practical implication is profound. When you experience sudden one-sided weakness, you're not just having a random event. You're seeing evidence that your brain's primary blood supply is failing and your backup systems are being forced to take over. It's like your check engine light coming on. The car still runs, but something fundamental needs attention. What Dr. Hinohara emphasized to his patients was the importance of the pattern, not just the individual event. One episode of arm weakness might be nothing, but if it happens more than once, especially if it affects the same side each time, you're watching your brain telegraph its vulnerability. The blood vessels that supply your motor cortex are showing you they can't handle normal demand anymore. And there's one more crucial element here: timing. These motor symptoms often happen in the morning, within the first few hours of waking up. Why? Because your blood is naturally thicker in the morning. After hours of lying still, your blood pressure drops during sleep and then surges when you wake up, and you're usually mildly dehydrated. This creates the perfect conditions for vulnerable blood vessels to struggle. Now we come to the third warning sign, and Dr. Hinohara considered this the most overlooked of all: sudden episodes of confusion, difficulty speaking, or trouble understanding what others are saying to you. This one is particularly dangerous because people often mistake it for something completely unrelated. You're in the middle of a conversation, and suddenly you can't find the right word. Or someone asks you a simple question, and their words sound like gibberish for a moment. Maybe you try to respond and the words come out jumbled, or you say something completely different from what you meant to say. Most people blame this on stress, lack of sleep, or just having a senior moment. But here's what's actually happening in your brain, and this is where the science gets really interesting. Language processing happens in very specific regions of your brain, primarily in the left hemisphere for most people. There are two main areas: Broca's area, which handles speech production, and Wernicke's area, which handles language comprehension. These areas are supplied by branches of that same middle cerebral artery we've been talking about. When blood flow to these regions gets interrupted, even briefly, your ability to produce or understand language breaks down. Now think about how complex language actually is. When you speak, your brain has to retrieve the right words from memory, arrange them in proper grammatical order, coordinate dozens of muscles in your tongue, lips, and throat, and monitor what you're saying to make sure it makes sense. All of this happens in fractions of a second. It requires an enormous amount of coordinated brain activity and a constant, reliable supply of oxygen and glucose. When blood flow falters, this intricate system falls apart. And here's the key: the type of language problem you experience tells doctors exactly which part of your brain is being affected. If you can't get words out but you understand everything, that's Broca's area. If you're speaking fluently but what you're saying doesn't make sense, or you can't understand what others are saying, that's Wernicke's area. Your symptoms are literally mapping the geography of your brain's blood supply problems. Dr. Hinohara noticed something crucial through his decades of observation. These language symptoms often came with a sense of frustration or confusion in the person experiencing them. They knew something was wrong, but they couldn't quite articulate what. And this is because language and conscious awareness are so deeply interconnected. When your language centers malfunction, it doesn't just affect communication. It affects your ability to think clearly about what's happening to you. The biology behind this is fascinating. Your brain cells, especially in these language areas, are incredibly sensitive to oxygen deprivation. They can only survive about 3 to 5 minutes without oxygen before they start dying. But before they die, they go through stages of dysfunction. First, they slow down. Then they start misfiring, sending confused signals. Then they go silent. When you experience temporary language problems, you're catching your brain cells in that middle stage, struggling but not yet dead. What made Dr. Hinohara's approach unique was his emphasis on the subtle nature of these symptoms. He told his patients, "It's not always dramatic. You don't always lose your ability to speak completely. Sometimes it's just a hesitation, a wrong word, a moment where you can't quite process what someone said. These micro-events are your brain showing you where it's vulnerable. And here's the critical point that ties all three warning signs together. They're all connected to the same underlying problem: compromised blood flow to your brain. The face drooping, the arm weakness, the speech difficulties. They're not three separate issues. They're three different ways your brain is showing you that its blood supply is failing in specific territories. Dr. Hinohara lived to 105 and remained mentally sharp until the very end, and he attributed much of this to one simple principle: listen to your body's whispers so you never have to hear it scream. These three warning signs are whispers. A full stroke is the scream. The science is clear. If you experience any of these symptoms, even if they resolve quickly, You need to seek medical attention immediately. Not tomorrow, not next week, immediately. Because every minute of delayed blood flow to your brain destroys about 2 million brain cells, and once they're gone forever. Here's what I want you to do right now. Think about the last month. Have you experienced any of these 3 signs, even once? Even briefly? If the answer is yes, I want you to make a promise to yourself. You'll get checked. Not because I'm trying to scare you, but because knowledge and early action are the difference between a long, healthy life and permanent disability. And here's the bigger picture. Share this information with someone you care about. Your parents, your spouse, a friend who's under a lot of stress. Because the life you save might not be your own. It might be theirs. If this video gave you information that could genuinely make a difference, hit that like button and subscribe to Prime Health Lab. We're here to give you the knowledge that helps you take control of your health, naturally and effectively. I'll see you in the next one.